Welcome to the UC Riverside 2026 Open Enrollment Benefits Review. This recorded presentation will be available to review at any time and can be found on the UC Riverside Benefits Open Enrollment webpage. All changes to benefit plan information and elections made during open enrollment will go into effect on January 1st, 2026. The plan rates have changed considerably this year for pay bands 1 and 2, and all are encouraged to review all medical coverage options to consider the alternatives. Please note, if your medical plan is not impacted by the changes for next year, or if you are satisfied with the changes to your current benefit elections and do not wish to make any changes, you do nothing, and your current elections will roll over unchanged. If you are enrolled in the flexible spending plans, FSA and DepCare, or the health savings account, you must elect new contribution amounts for 2026 in order to continue participation for the new plan year. We will discuss more about these plans later in this presentation. There are substantial changes to medical coverage plans, designs, and rates for 2026 and additional changes for non-medical plans. If you are one of those people who never pays attention to open enrollment, this is the year to change that. We want to stress the importance of reviewing the open enrollment materials on UCNet to review the changes and take advantage of the Alex Benefits counseling tool to assist in finding the best plan to meet your healthcare needs. In this presentation, we will review the new coverage options, added features, revised plan designs, and changes to your costs and out-of-pocket expenses. This information is provided to aid you in making quality decisions about your health and welfare needs. The trend of rising healthcare costs continues for the UC plans. The major factors contributing to the rise in premiums is to balance the share of increases across all pay bands, with specific pay bands and medical plans having a larger one-time impact this year. This change will help to keep UC benefits viable long-term and assist in avoiding even harder choices down the road. More information on this important topic can be found in an article posted on UCNet using the links shown on this slide. Let's get started and review the medical plan options. UC will introduce a new PPO medical plan provider and plan options for 2026. Blue Shield of California. We will retain the same medical plan providers for HMO coverage through Kaiser and HealthNet, the UC Blue and Gold plan. HMO plans offer care managed by a primary physician who also refers you to specialists for care. The new Blue Shield PPO plans, UC Care and Health Savings Plus, offer the freedom to visit doctors, specialists, and the medical facilities you wish, including the UC medical centers, without requiring a referral. All medical plans contain a behavioral health benefit, with Kaiser having an additional option for behavioral health care through Optum. Let's review the plan changes for the HMO coverage. There are several legislative mandates that impact the UC Blue and Gold HMO and the Kaiser plans. Under Legislative Mandate SB 729 for 2026, the UC Blue and Gold and Kaiser HMO plans will expand the coverage for diagnosis and infertility treatment to establish a specific treatment cost share that applies to the annual out-of-pocket maximum, increase the egg retrieval and transfers from 2 to 3 per lifetime, restarting the allowance for those who have exhausted visits to start again with 3 allowances. Related prescriptions will be covered according to medication tier level. Legislative Mandate AB 3059 adds medically necessary pasteurized human donor milk obtained from a licensed tissue bank as a basic healthcare service, ensuring all California insured families have access to medically necessary donor milk, and simplifies the process for hospitals to distribute donor milk when needed. Legislative Mandate APL 23-026 requires health plans to provide coverage for mental health and substance use disorder treatment services offered at a school site when the services are provided by a local educational agency or public institution of higher education. The benefit is available to individuals aged 25 years or younger. Legislative Mandate AB 2843, Healthcare Coverage, Rape, and Sexual Assault implemented in July 2025 for HealthNet and Kaiser, requires health plans to provide coverage for a 9-month period without cost sharing for urgent, emergent, and follow-up medical, mental health, prescriptions, substance use disorder, and other treatment and care following a rape or sexual assault. The mandate prohibits applying conditions or the requirement to receive care unless the individual files a police report to file charges against an assailant or for an assailant to be convicted of rape or sexual assault. Another HealthNet change is the enhancement of coverage of GLP-1 medications used for weight loss and treatment of diabetes. In 2026, there is a restriction for availability of this medication for weight loss, requiring a body mass index of 40 or higher to be eligible to be prescribed the medication. Those currently using the medication will not be subject to the minimum BMI level if physician certifies medical necessity. The prior authorizations manager for musculoskeletal care and pain management will move from Turning Point to Evelyn starting January 1, 2026. Virtual cooking classes is an added benefit for UC locations offering 5 classes at no cost. Under the Kaiser HMO plan, the coverage for the medically necessary GLP-1 weight loss medication benefits differ slightly. The eligibility criteria for weight loss medication for those who began treatment with a BMI below 40 will not have access to the medications if they do not have a comorbidity as outlined by the Kaiser plan. Now we'll review the PPO medical plans. New for 2026 is UC's restructuring of the PPO medical plan options with the move to Blue Shield as the PPO plan insurance provider. There were further decisions to discontinue the core and UC Health Savings PPO plans and replace them with an enhanced Blue Shield UC Care PPO, and the new Health Savings Plus High Deductible Health Plan with the Health Savings Account option. There are also enhancements to the UC Care plan. The following slides will offer a comparison of the plan design changes between Anthem Blue Cross and the new Blue Shield coverage. Accolade remains as the member services and care advocate, and Navitus remains the prescription benefit manager. This slide shows a comparison of the calendar year deductibles and out-of-pocket maximums for the new Health Savings Plus plan versus the previous Blue Cross plan designs. You will see an increase in the deductible with the Health Savings Plus plan for in- and out-of-network providers. The out-of-pocket maximums for in-network and out-of-network providers will also increase for the new Health Savings Plus plan. For preventive care, the zero deductible remains the same, and doctor or specialist's visits coinsurance increases to 30% for in-network and 50% for out-of-network providers after the deductible has been met. Accolade offers virtual primary care at a $30 copay before the deductible and virtual behavioral health care at 30% of $30 after the deductible has been met. A virtual second opinion from a leading specialist, acupuncture, and chiropractic and network services are available at a 30% cost share after deductible is met and 50% cost share for out-of-network providers. Urgent, emergency, ambulance transport, and retail clinic services increase to a 30% cost share after the deductible is met. The deductible is waived for ambulance emergency transport. Hospitalization services have a 30% copay for in-network services after the deductible has been met and a $360 per day benefit maximum with inpatient stays. For prescription coverage, the High Deductible Health Savings Plus plan has a 30% in-network and a 50% cost share after prescriptions are paid at full cost until the deductible has been satisfied. Mail order options are available for 90-day supply of medications. The Health Savings Account is available only to those enrolled in the Blue Shield Health Savings Plus medical plan. The IRS contribution limits for 2026 increases for single members by $100 and $200 for family coverage. Another great benefit is that UC has increased their annual contribution to the member HSA account as well. Those age 55 and over may make catch-up contributions, and Health Equity remains the plan administrator. To participate in the new Health Savings Plus plan, retirees cannot be enrolled in Medicare Part A or Part B. This also excludes split family members where at least one member is enrolled in Medicare. Members are also not allowed to participate if enrolled in the Health Flexible Spending Account, FSA. It is very important for members in either Core or the Anthem Blue Cross Health Savings medical plans to understand that UC will automatically transfer the enrollment to the Blue Shield Health Savings Plus plan. Once enrolled in the Blue Shield plan, any member with a Health FSA plan with a balance of $25 or more, those funds will be moved to the Limited Health FSA managed by WEX. Those funds must be used for non-medical expenses, dental and vision, by the specified end date, or they will be forfeited. The UC Care Plan will remain an option along with the new Health Savings Plus plan. The infertility benefits will be transferred to Blue Shield, and the plan administrator will transfer to Win Fertility. Pharmacy benefits are covered at a 50% cost share after the deductible is satisfied for in- and out-of-network providers. Pharmacy benefit changes will exclude the savings from copay savings cards being applied to the annual out-of-pocket maximum. Members currently using GLP-1 weight loss medications must have a body mass index of 40 or higher, and those starting the treatment program with a BMI of 40+ may continue after being recertified for medical necessity. Lodging and food expenses when traveling for surgery have increased and now include benefits for gene therapy for ocular disorders. The coinsurance for members will remain at 20% for services provided during international travel and continues to be managed by Blue Cross Blue Shield Global Core. Travel vaccines will also see changes for UC Care and the Health Savings Plus plans implementing costs based on provider tier and in- and out-of-network status. Member ID cards will be issued for new Kaiser members, and all members with HealthNet, UC Blue and Gold, will receive new ID cards. Blue Shield will issue one new member ID card for medical and Navitas Pharmacy Care, and Health Equity will issue new cards to new members only, while existing members will continue to use current cards. We will now review the updated pay bands, rates, and employee contributions. The pay band income levels were adjusted and based on the full-time salary as of January 1, 2025, last year's annual salary. The comparison of the variance in premium change for HealthNet, Kaiser, and Blue Shield UC Care is noted here for each pay band, where the change in employee costs are decreased for some medical plan providers based on enrollment option. The percentage change for the plans reflects substantial variations for the Kaiser medical plan across all enrollment categories and some decreases in premiums for HealthNet and Blue Shield. The reason for the increase for Kaiser is due to a sweeping adjustment to receiving a larger UC share of subsidized increases in past years. The change in coverage cost for members in pay bands 1 and 2 transferring from Core and the Health Savings plan to the new Blue Shield Health Savings Plus plan showed decreases in premiums for some members based on medical plan election and enrollment option. The impact on percentage of change is also noted. The comparison cost for members in pay bands 3 and 4 transferring from Core and the Health Savings plan to the new Blue Shield Health Savings Plus plan show increases and significant decreases in premiums for some members based on medical plan election and enrollment option. The impact on percentage of change is also noted. In this slide, we see the actual 2026 employee monthly premiums for each medical plan by pay band. Please use this information, the Alex Benefits Counseling tool, and the which medical plan is right for you. Comparison chart found on the Open Enrollment webpage on UCNet and the UCR Benefits webpage to aid in determining which medical plan design best meets healthcare needs while also taking affordability into account. The premium cost shares for represented employees will move to 2026 premium cost share and pay band levels, with some seeing increases, and a newly implemented UC subsidies for Kaiser and Health Net UC Blue and Gold plan members in EX, SX, HX, RX, and TX bargaining units. We will now review the updates to the non-medical benefits. With the significant changes in medical plan premiums, providers, and plan designs, members are strongly encouraged to utilize the Alex Interactive Animated Benefits Counselor tool to provide an in-depth explanation of how the plans work for your specific needs and income level, and a great resource for members to learn more about all benefits offered. Alex is personal and confidential, available in English and Spanish, uses member zip code to show only available providers, shows if preferred providers are in network, factors in out-of-pocket spending, offers guidance for out-of-state dependents, and available on multiple user platforms. Delta Dental continues as the dental provider. Coverage for Delta Dental Premier and out-of-network providers for certain services are increasing from 75% to 80%, based on the plan allowance. There are no benefit changes for the HMO plan designs. A slight increase in the cost of coverage is paid by UC with no impact on members. The VSP Vision plan also remains the same, and the 5% premium increase is covered by UC for all members. For 2026, Prudential Life Insurance has an 8% decrease, and accidental death and dismemberment has a 10% increase in employee supplemental life premiums. There are no other changes in basic or family coverage plans. AD&D coverage is open for enrollment, but the supplemental life coverage is not available at open enrollment and requires employees to complete a statement of health on UC Path for enrollment consideration. Prudential supplemental health plans for accident, critical illness, and hospital indemnity benefits have no changes in premium. The hospital indemnity plan admissions benefit observation period is decreasing from 24 to 18 hours. There is no benefit change for accident or critical illness. Enroll in these plans via the UC Plus website. The flexible spending account plans require renewal of your contribution amount every year during open enrollment. Failure to re-enroll disqualifies you for participation in 2026. The contribution limits have increased for the Health FSA to $3,300 and a maximum of $660 to carry over to the next plan year. The dependent care contribution limit is $7,500 and $3,200 for highly compensated employees earning $160,000 or more in 2025. The claim submission deadlines for expenses for the Health FSA and Dependent Care FSA plans are noted on this slide. Carryover funds should be exhausted and claims filed by the noted deadlines. The limited-purpose flexible spending account stores carryover balances exceeding $25. The funds in the account are used to aid in submitting claims for additional dental, vision, and preventive care expenses. Members may not contribute additional funds, and participation is limited to 1 year. The ARUG legal benefit premium remains unchanged. Be sure to take advantage of the benefit of creating a living trust at no cost and a wide network of available attorneys to assist with a variety of legal issues like consumer fraud, personal property disputes, and family law events. Disability benefits through Lincoln Financial are available for employees to apply at any time by submitting evidence of insurability, EOI Health Questionnaire on UC Path and is subject to approval. Bright Horizons offers a myriad of services for babysitting, home repair, and more. UC pays the Bright Horizons premium for this benefit for all employees. Additional employee benefit options include the UC paid Experian Identity Theft Protection Plan that has a credit college program available for faculty staff and dependent children up to age 18. Enrollment is automatic and members select the data elements to be monitored. The Adoption Assistance Program offers up to $10,000 in financial aid for eligible expenses related to adoption of a child and limited to 2 adoptions. Nationwide pet insurance is available by applying directly with Nationwide to obtain quotes for coverage year-round, not only during open enrollment. The UC Riverside Central HR Benefits team is available to provide an extensive explanation of your benefits. Please feel free to reach out to us at any time via email at benefits@ucr.edu, and we will be happy to assist you. Thank you for joining us. This concludes our presentation. We hope you found the information to be helpful and obtained what is required to make quality decisions about your health and welfare needs. Thank you for your time.